New at 5, all 50 states and Washington, D.C. are now seeing a rise in COVID cases. In 38 of those states, cases have gone up 50% compared to last week.
This as the vaccination rates continue to drop and the Delta variant takes its toll. Daryl Forges has the details.
Kim McGinn was a mother, grandmother, and elementary school teacher in Little Rock, Arkansas, who chose not to get vaccinated against COVID-19.
She firmly believed that it had been around for so long that she wasn't going to get it until she did get it.
The 63-year-old died from coronavirus.
This is becoming a pandemic of the unvaccinated.
The CDC says it's seeing outbreaks in parts of the country that have low vaccination rates. Low vaccination rates, combined with the dominant Delta variant, can be deadly.
Our biggest concern is that we are going to continue to see preventable cases, hospitalizations, and sadly deaths among the unvaccinated.
Data shows COVID-19 cases rising in all 50 states. The last time that happened was in early January, when fewer than 1 million people were fully vaccinated. To get more shots in arms, the Biden administration now pushing against disinformation about the virus and the vaccine.
We're calling on everyone, social media platforms, news organizations, individual Americans to call this activity out.
Kim McGinn's family is urging others to get vaccinated before it's too late.
You are less likely to get sick and wind up in the hospital. Now, that's not saying you might not still get COVID. I'm fully vaccinated and I still got COVID, but I recovered. The vaccine is worth it.
I'm Daryl Forges reporting.
Well, Pfizer's one step closer to getting full FDA approval for its COVID-19 vaccine. The FDA is granting priority review for the shot. That review process generally allows a 6-month process, and the company's set a target date for approval in January, but approval can also come sooner. There are currently no FDA-approved vaccines for COVID-19 in the United States. All 3 vaccines currently being administered are allowed under the FDA's emergency use authorization program.
Now, not everyone has decided to get the COVID vaccine. We know that. And as those individuals are getting a bit of backlash, it's a trend that you may not have heard about. News 8's medical reporter, Dr. Mary Gillis, is here with a little bit more.
Alexis, thanks. Health experts call it vaccine shaming. This is when people who are vaccinated lash out at those who have yet to get it. The practice is dividing families, destroying friendships, and can even affect the workplace. I reached out to Kimball Richardson, licensed mental health counselor at Community Health Network, for advice on what to do if a person finds themselves in the situation, whether it's the shamer or the shamee.
Times when these things happen, people want their emotions to be understood, along with the information. Look, I want you to hear me. And what that means is not only do I want you to hear what I'm saying, I want you to understand what I'm feeling emotionally.
If people can agree on that, Richardson says there's less of a chance of shaming others. He explains the motivation behind this aggressive communication is fear and anger. This is for people on both sides. Having a sense of self-awareness can temper these discussions. Additionally, Richardson says even if you don't agree, to be respectful of others' points of view. Dr. Mary Gillis, Wish TV, wishtv.com, and follow us on Facebook.
Now, Mary, when it comes to other places this can happen it happen anywhere else other than with our families and at work?
Well, we talked about schools. There are going to be different protocols. I mean, some kids who are eligible to be vaccinated might not be, and they will be wearing masks. Parents might be concerned, teachers, but Richardson says we need to have the conversation in advance. That's in those types of places, to have the conversation in advance.
Mary, thank you.
Thank you, Alexis.